Hi, I'm Jeannie Ralston, editor of Next Tribe, and live from Lake Austin Spa, this is Straight Talk about women's health. Thank you so much for joining us. We're really excited to be here. How excited? Well, I'm about to pee my pants. This is probably the only time that it's appropriate to say that, so here it goes. Which is a great segue to our wonderful sponsor, which is Poise. It's a wonderful resource for anyone with light bladder leakage like me. And they do light pads and liners to help you move around and stay active and stay, all together. So it's usually been that talking about light bladder leakage has been uncomfortable, but my thought is this year a film about women's periods won an Academy Award. So I think this has got to change. This has got to change. We've got to be able to talk about our bodies. And this is why we're here, is to really talk about things that you might not find people talking about other places. And we have great people to help us address these. One is Dr. Jessica Shepard. She's an OBGYN and women's health expert and a Poise spokesperson. And she has an online forum called Her Viewpoint.
Yes.
Which is where no subject's taboo there,
None,
right?
None of them.
And that's where we're going today, the no taboo zone. And we also have Cindy present, who's the fitness and activities director here at Lake Austin Spa. And she is the blogger for, it's called Get Out Girl.
Out Girl.
I love that.
Thank you.
And she's been around fitness all her life and has all these kinds of degrees in it. And one thing I loved, I found out the other day, is she probably has the best commute in the country. She comes to Lake Austin Spa on a paddle board. How cool is that?
Right there, yeah. It's
I
pretty
love
nice.
that.
It's pretty, it spoils
I'm
me.
moving in after.
Okay, come on.
So, so I wanted to start by just talking about my own issues, and I'm so glad we're having this conversation because I talk about it with my friends a lot. Like you see us at parties, there'll be a group of us going over to one side, and we'll be like, oh, we're laughing and stuff. But it's great to bring it out into the public. And what happened to me, my most dramatic story, I think, is that I was once in line by myself at a taco shop, and I had to sneeze, and I really needed Poise right then, but I didn't have it, so there was some fallout, let's just say that. I had to make a choice. Do I lose my place in line and go take care of it, or do I keep my place in line and pretend like nothing happened? Well, I pretended like nothing happened.
You're like, I'm not losing my place in
That's
line.
right, must be a good taco place.
It's a good talking place. I was like, I'm not. So that's my story. So anybody who's out there, I know you have stories too, because we're all, I understand it's like 1 in 3 women suffer
Yeah,
from
that
this.
is the statistic, 1 in 3. And I think that's such an important number to bring up because for so long, I think there was this perception that it only affects certain type of women, if they've had 6 children or if they've done horseback riding for their entire life. But 1 in 3 women experience this. And for an OBGYN, we see women from the time they're adolescents all the way, into their 80s or 90s or however old they are. And we see light bladder leakage from as early as someone in their 20s to someone who as old in their 80s or their 90s. So there are various reasons why you might have it, but I think bringing up that statistic is very important.
Good. And why, Next Tribe focuses on women over 45.
Yep.
And so is it so common now and women are in the Next Tribe age group?
Yeah, and so as you get older and into your 40s and your 50s, that's when there are multiple reasons. So childbirth is one of those. I think just age. We're wonderfully and beautifully made, but as we start to age, some of our body parts don't follow as we would love it to do. And also one of the things is estrogen. I think estrogen, for me, I think it's a powerhouse of the pelvis, but once we start to have a small decrease in our 40s of estrogen and then complete depletion after menopause, it actually affects our tissue. So our ability in our pelvis, that is going to affect the bladder, that's going to affect our vaginal spaces. And so what you'll see is as you start to have a decrease in estrogen, the collagen effect of the tissues, the ability for your sphincter so you don't leak, all of those decrease. And so what you'll find is that as estrogen starts to go down, the function of what our pelvis does also starts to diminish as well. And you'll start to see some of those things like you were mentioning, which is light bladder leakage.
Yes, and so Am I the only person who's really that's happened to? Maybe I'm the only person who's stayed in line. You know,
You might be the only one who stayed in line, but I like that about you. I like that about you. Yeah.
So, but how common is it for to have something that you're in public? like
Oh,
that?
I mean, I think it's a 1 in 3. I mean, at some point, that leakage can be anything from a few drops here and there, occasionally, to every time you laugh, sneeze, cough, jump.
Work out.
Work
They're
out,
active.
exactly.
Absolutely, we hear it all the time.
And so that affects how much women will go to happy hour, because if they're laughing at happy hour and they experience leakage and that's uncomfortable, or working out, those are the things that how you start to see it play into your everyday life, because you're not being able to do the things that you love, enjoy the people that you love, because of the slight bladder leakage issue.
And are panty liners the only thing to do, or what else
No,
can
I
we
think
do?
that's the beauty of science and technology, and that's why I've partnered with Poise, because they actually do place so much emphasis on not just the ability of what they offer in their products, but also the comfort and the flexibility that women can have with these products. So for example, they have, I think they're like leading in what they can provide for women. So you do have your Poise pads, which again is for collection when you have light bladder leakage, but now they have ultra thin pads. So those are going to allow you with the Thin Flex technology to have that comfort when you're working out, when you're waiting in line, when you're at happy hour and you want the ability to have something that's thin, and you're not necessarily going to have that bulky feel that I think a lot of women associate,
Yes.
pads with. And then you're going to have the ability to have, as far as the absorbency, you're going to have that flexibility within the ultra thin pads from Poise as well.
Well, and Cindy, tell us about, you work with all kinds of clients, and what do you hear from women about this issue?
Well, many times people are embarrassed, right? And so we really just try to help build confidence, and
Yeah.
being active builds confidence. And also what I find is that if we're open about it, and it applies to many things in life.
Yeah.
It's like mental wellness, right? If we're open
Right.
about our mental wellness, then we gain confidence, and we move away from what's taboo in a conversation. So with LBL, we talk about it in our workout groups. Oh, gee,
Okay, whoops.
But then people gain confidence, and then what happens is they move from the I can't mentality to I can. This is
Yeah.
just part of it, and I can. And that mentality then shifts and becomes a snowball effect for so many other things of taking charge of what you can take charge
Right,
of,
yeah.
right? So it's not just an isolated, siloed situation. It's being able to have the right tools, like Poise provides a great tool for this, and then to change the mindset, and then change the verbiage, and that it empowers a female to do anything above and beyond that as well. So
Right.
it's so much of a bigger picture than just LBL and what's
Yeah,
taking
so
place
you
there.
wouldn't want to stop working out because
Right,
of this.
exactly. I mean, I have a thing with my clients. If I hear them say, I can't, it's 50 push-ups,
Right,
and everybody
right,
knows it. And so, but what happens with that shift, though, because we find ourselves using negativity in our self-talk so much that I can't becomes a habit, and then every time you say it, it has such such an impact on your
Absolutely.
mind. So that if we change that, yes, I can jump rope. Well, how
Yeah.
can I? Well, I can use Poise. I
Right.
can wear black ties. There's things I can do, and then that confidence really exudes and snowballs into many other aspects of your life.
Well,
And that confidence generates the conversation, just like we're having here.
Right.
So I think there are a lot of products or things that are on the market, and not just necessarily with LBL, with anything that we deal with as women. But if we don't talk about it, we would never know that they're available.
Right.
So in your class, if someone were to bring it up to you, be like, oh my goodness,
Yeah.
now that you're telling me I can offer you these products, or they didn't know that Poise Ultra Thin pads were available, but now that we're talking about it, the confidence, I think confidence
Exactly.
is such an important part.
Right, right. And for me, it's the jumping jacks. It's like, don't get me near a jumping jack. or if I even look at a trampoline, I think I have to start to pee.
We can
So-
get you to do some jumping jacks today.
There we go.
And we
Product
have
test.
some
We'll
perfect
be-
products for you,
We'll
yes.
test them out, we'll test them out. But what about Kegels and we were talking about exercise? That seems like a good
Yeah,
thing to talk
no,
about.
pelvic, I think that is a beautiful part of my specialty, is because I literally talk and look at the pelvis all day, like literally. And what we don't realize is that it's actually so rich in the amount of muscles that are there, the nerves that innervate that area, the bone structure. And so sometimes we think it's like just one muscle, or just like one thing, the pelvis is one thing, but it's really intricate. And I find that as we start to have some of these things that happen, LBL, and also some of that pelvic organ prolapse. That's a whole nother discussion.
Yeah.
Right.
Is that pelvic physical therapists? I truly love working with pelvic physical therapists because they have the time and energy that I may not have in the office to actually focus on pelvic muscles and how to help women do those exercises. So
Wait,
Kegels
there's
is
something called pelvic physical therapist?
yes.
I had no
Everyone
idea.
write it down. Pelvic physical therapist, yes. And I work with them in order to help women who might have some bladder leakage or pelvic organ prolapse to help work out the muscles. So it's
Right.
basically,
Same thing.
instead of doing your biceps and your
Yeah.
triceps, you're actually working and focusing on those muscles in the pelvis to help strengthen them and help combat some of the issues that women have.
What about when I was doing a lot of yoga, it helped me control that a little bit
Yes.
more. But, and then I'm doing other things now. So what about yoga and Pilates and things?
Very helpful.
Absolutely, absolutely. Anytime you're going to create some type of firing within a muscular system, it's going to be helpful. And because it's that mind-body connection. And Kegels, I mean, is to
Yeah.
me, I remember when I first started, it was
Yeah.
one of the most difficult, like, what, oh,
No.
got it,
Yes.
right? But
And I think a
it's
lot
that
of women do
mind-body
it, but
connection and that
don't
firing.
know exactly
really doing it.
what it is.
Exactly.
And see, like you said,
Exactly.
ooh, got it.
Yeah.
But you were focusing on
Well,
it.
yeah, exactly. I've done
That's
it many
great.
times in line, having to go to the restroom, right? That's what I'm doing.
Getting the taco.
Exactly.
But does if you are doing yoga, does that help with the LBL? The kind of like just those core
The core
exercises and zipping
Absolutely.
up. Is that what we're talking about?
When we think of core exercises, it actually is, abdominal working into the pelvis, because a lot of the muscles in the abdomen actually insert or continue into the pelvis. And so when you focus on some of those exercises that Pilates and yoga can offer you, you're actually now building those muscles that contribute to the control of your pelvic muscles, and therefore you're going to increase the strength of your muscles.
Okay.
Yeah.
And do you ever hear people like getting worried about drinking too much water while they're working out because they don't want to have a problem? I mean, we need
Yeah.
to probably
Work out.
emphasize that's not a
That's
solution.
It is. I think that is so important because it's only going to make matters worse. One, hydration is important for you being fit, and it's also important to emphasize hydration does not mean drinking lots of soda and iced tea and sugary drinks. It means drinking water. Now, specifically for women who suffer from LBL, I think sometimes they feel, I'm going to decrease the amount of water that I'm drinking so that I don't have an accident. But again, we have products that can help with that. But actually, bladder training is one of the things that we find with women. They can still drink the amount that they should, and usually we're always deficient in what we're drinking. So they should drink what they should and more. But bladder training is one of those important features, and a lot of times we just hold it too long. And so when we hold it too long, the bladder again is distending too much. It's collecting too much fluid and urine. And when you don't drink enough, guess what you're going to be more susceptible to? Infections and irritation and irritability in that bladder. So again, the key is for women to drink as much as they should and more, bladder train, and then talk to their gynecologist and their pelvic physical therapist if they ever find one to how do we help control those muscles of the bladder while still hydrating? And then also knowing what your products are that are available for women who do suffer from light bladder leakage.
Well, I like that idea of like training your bladder.
Yes.
And, I mean, what I call it is like before I go to a movie or go in a car, I call it a preemptive pee. Like
Yes.
the last thing I do before I get in the car, before I go to a movie is like have. 'Cause I don't-
And that's actually the simple fact that you do that is so important because how our brain functions and the recognition that we need to urinate is based on the action. So if we train our bladder by every 3 hours sitting on the toilet, not necessarily needing to go,
Yeah.
but you're sitting, it actually triggers to your mind, urinate. Rather than storing it for 8 hours, which is, I'm sure we're all guilty of that. I'm very guilty of that. And then you're actually, your
Yeah.
bladder's like, help me, help
Right,
me.
it's angry.
Yeah.
If you're just joining us, this is Straight Talk about women's health, and we have Cindy President and Dr. Jessica Shepard with us, and we're getting into some good subjects here. We've talked about Kegels and light bladder leakage, and I wanted to bring up something that a couple of friends have told me that they will actually, they'll see their bathroom door and they're walking towards it, and it's if somebody's in there, that's when they have the problem. It's like we're Pavlov dogs. We see bathroom door. Ah! So, I mean, is that what you're talking
That
about?
goes exactly to how our mentality of drinking a lot of water and then you store it and then you see something and you're like, I've got to go. Your mind knows. And so it triggers your bladder to be like, we got to go. But your bladder's like, we're not ready yet. And so it's actually training the bladder to go when it's not as full. so that you're now triggering to go when you should go rather than when you're like, hold it
Oh, right.
forever, and your mind's like, I see that toilet, but it's locked. What do I do?
What do I do?
And then you have the accident.
You know, I just thought of this. Maybe we should have a bathroom break for
Right.
when we're talking about everybody out
Everyone
there
needs
going,
to use the
oh
bathroom.
my God. So here we have some great questions, and one of them, this is my favorite. It's I've heard of a new expensive women's vibrator that's supposed to help tone the area. Thoughts?
Well, now we've just changed the whole conversation. Now we've gone from LBL to vibrators. I love it.
Yeah, I know,
let's,
really.
let's
It's
do
like-
it.
We'll let you field that one.
But no, so it's not technically a vibrator. What they have now, and I love this, it's called Femtech. So Femtech is kind of that space which being here in Austin is actually very helpful. But it's creating things for women's health, technology for women's health that's able to help us get better in our health. But one of those things is what we call a pelvic model. And what it is it trains your pelvis and the muscles, including your bladder muscles, to work better. So for example, we were talking about a pelvic physical therapist, which is a physical therapist that just focuses on the muscles of the pelvis. This is now a trainer that you can do these exercises outside of those visits, at home, at work. So they're not technically vibrators. What they do is they actually have biofeedback, and that biofeedback actually allows you to track what you're doing on an app on your phone and say, okay, now that I've worked out my pelvic muscles this way, I'm gonna do it to this exercise. It's similar to the apps that you find in fitness where they'll say do 10 push-ups, or they'll do now bicep curls. It actually tells you how long to hold your pelvic muscle
Like
and
in a-
how to release.
like in a
Yes.
Kegel.
And the reason why I find those are actually very good devices is because some of the things that are out there for pelvic health, they just require you to hold. There's no biofeedback. So you're just holding all this time, and what can happen over time is that your pelvic muscles can actually get too contracted because all they're doing is holding. There's no release. And you can experience this when you're working out. You need that contraction and relaxation to actually get the muscle to do what you need it to do. So if people are just constantly in contraction and flex mode, that's not what you're going to get your best benefit from. So they're great.
And so are they called vibrators or
They're
not?
called pelvic trainer models. So Elvie is one, ELVIE. I actually use that with my patients quite often if they're looking for that type of training outside of a pelvic physical therapist. And those ones, again, give you the biofeedback.
Okay, now I'm going to just ask the question. I
Yes.
know you're thinking thinking this. So will we enjoy using the pelvic?
I think initially it will be, you're focusing so much on like the actual exercise, but there are plenty of women who will be like, well, on the flip side of working my pelvis,
going
I
everywhere.
did actually get some pleasurable moments, which I'm all for as well. So maybe you might get, kill two birds with one stone. Yes,
And
absolutely.
we're all about efficiency, right?
Yes.
Time management.
Yes, exactly.
Well, what about, I've got something here about, a lot of people have asked us about osteoporosis, and I want to ask you about that, to start with, about what the role of exercise is in preventing osteoporosis. Is that people are really nervous about getting it.
They are, and the big picture of activity and exercise is in my world, it's the first medicine to try.
It absolutely
right? And
is,
you can back me
absolutely.
up when we go a little deeper on this.
Yeah.
But the first medicine to try for so much, whether it's mental, physical, emotional, exercise truly is a go-to. So for osteoporosis, activity, movement, weight bearing. So either weight bearing with weights or weight bearing with your body. To walk, to whether it's outdoors, treadmill, super important. I do have some clients who come in and it's like they're so phobic, or they're at such a level that weights are scary. Elastics, resistance bands. We have the new Da Vinci board here, which we use a lot with individuals who may have that little bit of fear of using that iron weight, and it's just resistance. So I've seen so many great situations with individuals really turning the tables on that.
Yeah.
And then going to the medical alternatives
Oh,
too.
absolutely. I think one of the things, and I hope this resonates to anyone listening today, is as women, our bone loss really starts in our mid-30s. And so, we start to see a depletion in our bone mineral density in our 30s. So by the time we're, again, menopausal, I'm going to talk about estrogen because I love it. Once you have that depletion of estrogen, your bones are basically like starving. They're like, help
Oh,
me.
God,
And so that's why you start to see, you know, fractures and falls and hip fractures after menopause, because your bones are lacking that estrogen. And so that's where the weight bearing activity kind of falls into helping build that bone structure again. So we can't really necessarily build bone again, but we can help prevent it from depleting. And so that's where the exercise comes into play. And I think too, there are a lot of people who are very scared of weight, especially women. We associate it with like big and bulky,
Right, yeah.
but it actually is very helpful for our bones. But I think once you build that confidence with the bands and the weight bearing activities using your body, your own body resistance, then you can actually not be as afraid of weights and move into that realm. And then also with medical and medicine, working into that, making sure that you do see your doctor. And there are medications that some women who are severely depleted of bone mineral density can take, so that we can really short stop that depletion of bone, which is helpful. But I do think that exercise, to me, I think it's one of the things that can cure so many diseases, whether that's, you know, light bladder leakage, osteoporosis, anything to asthma, hypertension, diabetes. It runs the
Yeah.
full gamut. Exercise is beautiful.
It's great.
Yeah.
So, do you recommend that women get a bone density scan at what age? Or
Yeah,
what?
so the recommendation, I have a lot of women ask me this because I think they feel like 50 is like the magic age for DEXA, but actually the recommendation is at 65
Oh.
for all women across the board. Now, if women do have a specific random fracture that doesn't sound like it falls into what should happen, if they are smokers, okay? So that's why smoking is not good, because it actually depletes from
One
bone.
more reason.
Yes, one more reason that smoking is not good for you. That actually increases your risk of fracture. And also for women who actually are smaller boned, might want to get their DEXA scan earlier, but it's not necessarily a mandatory thing. And family history is always important. So knowing your family history and any women in your family that have maybe suffered from really bad falls, bad fractures, bad bone disease, should talk to their doctor about possibly getting a DEXA scan before the recommended age of 65.
So, if you're just joining us, we're talking about osteoporosis, but we have been talking about light bladder leakage and some other thing, vibrators.
Yes,
So-
we got that one in.
We
I'm
got
so
that
glad.
one
I'm
in.
so glad.
We might even go back to that
Yes.
subject, so stay tuned. But for osteoporosis, should you be taking calcium? I mean, I do. Is that right?
I think we've gone back and forth with calcium. It's one of those things where sometimes, you know, in the medical field, we're like, yes, calcium supplements are absolutely needed in a certain amount. Sometimes we go back and we're like, well, how much? And who is it really appropriate for? Calcium supplements are not bad. They're not bad at all. But there always is a caution on how much you're taking. So making sure that you talk to your doctor based on your age, what is the recommended dosage? If you're someone who specifically maybe has kidney issues, should you be taking calcium that can predispose you to maybe some kidney stones?
Oh, God.
So there are certain things that you'd want to make sure that are cleared by your doctor before you just like go all in with calcium supplements. But for the most part, they are pretty good for you, and not necessarily you should stay away from, but you should also talk to your doctor to see if you fall into a category.
And Cindy, how often should you exercise then? What's the recommendations to help?
You know, the
prevent?
whole science around exercise has changed so much. And I think in the conversations with the 45 and 50 plus, it turns from that aesthetic need,
Yes.
right, to life function and longevity. And now the science is, which I love as an endurance athlete that has spent hours upon hours and many chapters of my life training, and the science now is moderate to intense exercise. And truly, you can get 20 minutes a day. You know, we're looking at 150 minutes a week for moderate exercise, and half of that for sets that are a little bit more intense. And I know with the weight loss that women
Yeah.
experience at this chapter too, those shorter bursts of energy at higher levels have a great effect upon that. Metabolism changes, and I'm
Yes, we
sure
have
that's
a-
part
we
of
have
our
a question
topics,
about
right?
that.
Metabolism
Yes.
plummets, and a lot of that is the loss of muscle. A lot of that is the change in activity, and you know, a change in cortisol, a change
Yeah.
in that stress hormone of what we all deal with in this
Right.
chapter. So. Exercise in those short amounts of time that is quality, right? You're doing some moderate to some higher intensity that has some of the bone, the weight bearing activity in it is the best. It is the
Right.
best thing
Yeah.
to shoot for. It is efficient. It is a big bang for your buck, if you will, for your time, and the results are there.
Well, and we had a great question from one of you, and keep those questions coming. They're wonderful. And one funny writer wrote, "How to deflate the spare tire that has appeared around my waist?"
I think metabolism is a big part of that. Estrogen and cortisol are one of those things that you see after menopause that do the things that you're like, no, don't go that way. You know, estrogen goes down, cortisol goes up, and you're like, no, go the other way. And so exercise is that big part of, for example, that question that you were saying is like, now we start to store a little bit more of our adipose tissue because of the depletion of estrogen. And so, and the cortisol too, increasing allows us to store more, and our metabolism goes down. So I think the incorporation of not just, and I wish people would not see it as just like exercise, but as lifestyle. And that's what I preach to my patients as well. So if they can get, you know, ahead of the menopause and get that incorporated into their everyday life and their regimen and just 20 minutes of movement, action, they really can counteract a lot of those things that come around menopause. And also our diet. What are we eating? What are we putting into our bodies, and how are we able to utilize that energy that's being stored? That comes a lot from what we're putting in our bodies as well.
So you should be doing this ideally before menopause hits, but it's not, even if you're in the middle of menopause or past, it's not too late.
Oh gosh, no,
No,
it's never
absolutely
too
not.
late.
Never too late.
Never too late.
Absolutely not. I mean, adopting those healthy aspects of life, and I love it because I'm that same way. It's a lifestyle.
Yeah.
You know, it's not exercise, it's activity, and that's actually one of my most favorite things about fitness trackers, which I don't like. I mean, fitness is the outcome, right?
Right,
Fitness is what you get when you're active. But with a tracker, at the end of the day, when you sit down and you look at how many steps, that tracker is not saying if you went and ran a half marathon, or if you mowed the lawn, or if you took your dog for a walk, or if you walked with an elderly neighbor. It's activity. So it's just really about finding those things that you can embrace in your lifestyle and make it a habit, or share that habit, or become accountable to that keeps you moving. And you know, I had a lady the other day who said, okay, I'm making for spring, I am not going to hire the guy to rake my leaves. I'm going to hire the guy to pick up my leaves, but I'm going to rake my leaves, right?
I like that.
Because she knew she loved being outdoors, so she knew there was that whole mental wellness component to being outdoors in nature, right? That's a huge aspect to mental wellness. And she could be active. And she called me at the end of the day. She goes, I got 20,000 steps raking leaves. I haven't moved 20,000 steps in so long. I didn't want to pick them up, but I feel so full and connected having just gone out and spent time in my yard and raked.
And did something productive.
I think
And she was
my
active,
worst one is like not parking close to the store.
Yeah.
I mean, my husband will be like, why are you driving? Like, just park the car. Like, so I'm like, I'll drive in like loops and loops just to find that close parking space. He's like, just park here and walk.
Yeah. And then
And
you
I'm
get
like,
the-
okay, I guess.
Right.
That's going to be mine.
That's going to be
Yeah.
good. And that's
Well, and my paddling to
yes,
work.
paddling
You know,
to work.
sometimes
Can we all do that?
Right, let's just
Right.
pedal to work.
Well, sometimes it would be easier to hop in the car, stay in my
Yeah.
space, go, get in the car, drive, not even realize how I got there, versus, okay, you know what, I'm going to be a little bit more intentional.
Yes,
I'm going to get on my
intention.
board. Intention's huge. I'm going to get on my board, and I'm going to collect that time to myself and really
Yeah.
ground. And I'm a whole different person when I get here by water and land at the dock versus scrambling, getting my car, and go.
So do they know when you, Cindy drove today,
Yeah,
watch
stay
out.
out of her way. She drove. But intention is huge, and
is.
living intentional is such a big difference. And I think that's one of the gifts that we have at this chapter in our lives, is to be intentional. I mean, we're a unique generation in what we have seen and come through. I mean, we've come through being a very unplugged generation. I mean, what was a cell phone then, right?
No
to
idea.
subtly plugging
Pagers
into
were
now,
it. Right?
to now just being so inundated and so, if you will, unconsciously living. And really now, just if we could just turn that switch of being conscious. This little ring I put on because it's my moment, my intentional icon, right? So when I look at it, I'm like, oh, are you breathing? Are you observing? Are you
great.
in your
Oh,
body
that's
at
a
the
great
moment? Or are you
idea.
everywhere else? So that intention, I
Yes.
think, is one of the biggest things we can gift ourselves with
It
for
can
mental,
carry
physical.
you so far in life, and not necessarily, it's always the quality of life. So you want to, with your intention, like increase your longevity, but making sure that it's quality too.
right,
And I
right.
think sometimes we're so like focused, unplugging from my phone, try and grab my phone. That's
Yeah.
not even happening.
Yeah.
But sometimes I'm like, you have got to stop. And I think that's one thing I hope that we can teach the next generation, is to take those moments to unplug. So I'm glad that there are those apps now that, you know,
Right.
help you to
Get
kind of calm down.
calm and-
But I'm like, but you still have to hold the phone to recognize
I
that.
know.
They recognize it. Yeah, yeah.
So at least it's a step, but I appreciate for what it is.
Yeah.
But intention to me is so important.
So if you're just joining us, we're here with Dr. Jessica Shepard and Cindy Present, and we're talking about all kinds of things. Right now we're talking about exercise and fitness and lifestyle, not just exercise. And we've gotten questions about that. And one question we got was somebody wanted to know that she says now that she's working out, everything she used to love to do hurts now. And so she's looking for something that will, so she can get motivated to exercise again, but without it hurting. So
I love water. Water aerobics decreases the impact
Right.
on some of your joints, your bones. And so when I was just about to enter medical school, I worked at a rehab center and I worked with so many people who had some of those issues, and we would do water aerobics. And I found that that was a way to still get your heart rate up, still have movement, but decrease some of that impact on your actual body and not make it hurt as much.
Right.
And sometimes it can be in a heated pool. And that's
Exactly.
the best
Oh,
thing too.
yeah.
So
Well,
you
it
can kind of get
is.
some
It is.
therapeutic remedy from that as well.
And like Austin here, we have a big intentional push to talk about the effects of water.
Yeah.
So we try to do as much on land or as much in the water as we do on land. And so not only in the pools, but then taking activity and fitness to being on top of the water. So we do, you know, what might be a boot camp that would be done on land, we take those to floating mats on the water.
Oh my God,
Because
so
there's a
much
whole
balance.
cognitive, but there's
Yeah.
also a whole cognitive element that's called the blue mind science of what being in, on, and near the water does to your mind. So you not only get that physical part, but your mind behaves so much different in nature, and then also on the water. So it really downshifts it cognitively.
I'm coming back for a
It adds
class.
that
I know, I
peace,
know.
I want to try
it
this.
adds that creativity. So you're getting kind of double bang for your buck.
Yeah.
So yes, being in the water for applying an activity that doesn't hurt, fabulous. It takes that gravity away. But then you also get that mental effect and that relaxation effect that you, again, we don't have a lot of time, right?
Yeah,
So when you're
forget it.
trying to make your choices, water is a great aspect physically and mentally.
And also stretching. It doesn't necessarily need to be 15 minutes. It can be 5 minutes of stretching right when you get up, right before you go to bed, and being intentional in what stretches you're doing, shutting the mind down and just really focusing on stretching. And also, there are therapists that are myofascial stretch therapists. They actually focus on a different type of stretching that really kind of triggers some of the joints and ligaments. So people who might suffer from arthritis or maybe like deep tissue injuries from sports, that can actually help as well. So there's, I just feel that like in this space, there are so many
There's so much.
resources for women to be their best.
So the woman out there who wrote about finding new exercises that feel good, that's
Yeah.
some great
important.
ideas.
And it's important to feel good. I mean, we do the myofascial release in the water. It's called aqua stretch. We
Yeah.
actually have a therapist in the warm water who works with your
Yes.
myofascial. But even to take that another step, and we've talked about being active, and then we talk about the stretch, but that meditation component, especially 40, 50, 60, 70s, because of the cortisol.
Yeah.
Right? So reducing cortisol becomes
Reduces
as
stress.
important as physical activity as well when you're talking about weight gain and whatnot. So that meditation, sometimes it goes to the bottom of the list when we think, oh, I have to choose between being physically active or stretching
Yeah.
and mobility and flexibility. But meditative moments are extremely important at this age for cortisol reduction.
And it can actually help when you're having bladder moments too.
Oh, really?
Like
Okay.
I've actually had to use that. So bringing, like really focusing on your mind. I've had moments, especially after I had my 2 kids, I did have light bladder leakage. And so there are moments when you're out and you're like, I've got to go. And I actually focused intentionally. I'm
Oh
like,
my
you can hold this.
gosh.
And it worked.
I
It
love
works.
it. You can,
Absolutely.
You can meditate it away.
It's kind of like you're blocking everything out. So you're blocking out those neural pathways to just focus on your mind, focus away, get to where you need to go,
yeah. Then,
and then use the
in the
get that.
appropriate place. There's always a
Then
Yes.
find that bathroom door to look at. Really.
Well, I love that the idea that you can meditate. I know that I've talked to a friend of mine who's big into yoga, and I said I always have this belly I can't get rid of right here, and she said maybe it's stress belly. I don't know if there's such a thing.
Absolutely.
And so it's just won't go away because is that the cortisol that's just
Well, it contributes to that. And that's it, that, I mean, there's a direct correlation with when you look at heart disease, which is the #1 killer of women in the United States is heart disease.
Wow.
And so what they do know through science is that women who, the more that you hold here in that kind of central area, directly links to heart disease and heart attacks and strokes. And so that's all directly related to cortisol. And so if you can like mix it all together, it's all about incorporating all of this together. Is if you know your cortisol levels are high, focusing on meditation, stress reduction, so that whether that comes through yoga or intentional living, mindfulness, then you can actually decrease your cortisol. So then when you work out, it's actually more effective. Then you're actually focusing on reducing that.
Oh, that's good.
See
to
how
know.
it's like
Yeah,
it's all
yeah,
connected.
yeah,
It's all connected.
So that and cortisol is. Can you get tested for it, or do you just
You can-
know when you're like?
Your adrenal
stressed?
glands are actually like the organ that's most responsible for your cortisol release. It's very pulsatile, meaning it likes to send off cortisol at certain levels of the day or certain times of the day and certain levels. And so sometimes what happens is when we're kind of like not connected or we have disease that are interfering with that cortisol release, that's what happens. And so there are ways to reduce that. I find that integrative medicine, so integrative medicine doctors focus on that a lot better than some of us our Western medicine doctors do. And so finding some of those doctors can also help because they can actually target cortisol levels. You'd have to do like tests that require maybe 24-hour collection. And then what they do is they're like, this is where it is. This is where you need to be. This is what we're going to do to get you from here to here. And so absolutely you can monitor your cortisol with the right doctor.
With the right doctor.
Absolutely.
And okay, well that's good to know
Yeah.
too. And since we're talking about hormones, I should say if you're joining us, we were talking about cortisol and stress hormones. Now I'd like to talk. We've had a lot of questions about hormone replacement therapy. And next time we did a huge story about this. I had writers working on it, more than one at one point, trying to get the last word in what we should need to know about hormone replacement therapy. It's a really complicated subject.
It
so we have
is.
lots of questions about it. Is it a good?
I think this is like one of the top 3 questions I get in the office. I'm a big proponent of hormone replacement therapy because I know the benefit of it with the right people. Knowing your family history, your past medical history is an important part of that as well. But when women come into my office, I would say usually it comes from hesitation. Should I take it? Is it okay? And that comes from the study that was done way back in the 90s, and it was a great study, and then it kind of turned, and we were like, no more hormones, no one should get any estrogen.
Yeah.
And then when we actually looked back at the study, we realized, oh, well, we actually looked at a subset of women who should maybe not have been getting hormones. And
They were older or something, right?
they were older. Some of them were smokers. We're like, okay, this was not the community we should have looked at when we were looking at hormones. But if we know estrogen is so protective. It's protective for the mind. It's protective for the bone, the heart, and obviously the pelvis,
Right, right.
including the bladder, which is some of the things that we brought up today. But hormone replacement therapy for the woman who actually is looking for something that can rejuvenate, whether it's libido, whether it's some of the things that they're going through with hot flashes, night sweats, irritability. I love giving women that option of hormone replacement therapy, knowing the dosage they should get. Sometimes testosterone is needed. Sometimes a
Really?
little bit of estrogen, progestin is needed. So in those bioidentical hormone family,
Right.
we can usually find what levels they need and give it to them. At the end of the day, I always tell women, why don't you try it? Because if you try it and don't like it, guess what? We'll stop taking it. But I feel like it's such a useful resource for women to try that if they try it, a lot of them come back, they're like, I love it. And I'm like,
But is it kind of like, I mean, hormone replacement therapy, could it address a lot of the things that we were talking about today? Like,
Absolutely.
like your pelvis health, your bladder, all
your
that?
pelvic health, but also for light bladder leakage, we know that we have options with the ultra thin pad, the poise pads. They have such a variety of pads in their family that are catered to light bladder leakage. But there are other options. We talked about the pelvic physical therapist. There's also vaginal rejuvenation. I know that that's a hot topic as well.
Oh, that's right.
Yeah, and so
that's wait, is that when you get it sewn up?
no, that's this.
Sorry.
We don't sew up the entire vagina, but what we do.
I meant, you know.
Don't worry. Someone else out there was thinking the same thing. But there are surgical and non-surgical options. But yes, you can do the surgery where you can kind of reduce that area vaginally, but also for example, the technology where we can use the CO2 laser or the radio frequency energy,
Oh
and
my
that can
gosh.
actually help with some women who are suffering from light bladder leakage as well. So there's so many options for women who are like, you know what, it's occasional. I prefer wearing something that can help collect. The good thing is that Poise, I think they focus on urinary light bladder leakage, which is different from sanitary pads. It's something that I was meant to bring up, earlier, and I didn't, because some people are like, I just wear a pad. But pads actually weren't made to collect urine. They're
Right.
made to collect blood when we're
Right.
having our menses. And so this is a different technology in how it was composed to collect urine.
Right,
And so that's why it's important for women to know that there's a difference, but also that there's a plethora of resources or types of pads that they can use. But aside from that, pelvic physical therapy, being intentional, decreasing stress, watching what you eat, because obesity is going to play a factor in how much you do leak
Oh,
and how
so-
often you
okay.
leak. Absolutely. And then also diseases like diabetes is contributory to stress urinary incontinence. So making sure that you are taking your meds well, decreasing weight is helpful. But I think that there are just so many options out there for women that we should never suffer in silence. And again, building the confidence so that we can bring up conversation topics, so that we can have all these women watching today who might be going through some of these issues, that they'll be like, I never knew that that was available.
Yeah, well,
And-
I've learned so much. already.
Yes, I love it. No, these are great topics, and I think
then
women
those,
will learn.
And those that have tried it to now feel
Yes.
okay to share their experience, because
Yeah.
that's so empowering.
I mean, I think women, we know that we're very word of mouth. So, like, I mean, it goes from like our hair, where'd you get your highlights done?
Sure.
Yeah.
And, how did you get that done? Where'd you get those clothes, those shoes? I mean, we've already swapped stories on shoes
Yeah.
today. So that's what we are. We're a collection of people who like to share stories. And if we can share our stories with some of the things that we go through that are taboo, then we'll learn so much from each other.
And that's part of why I started Next Tribe, is
Yeah.
that I didn't feel like there was a
Absolutely, a forum for that.
vehicle for women our age to share these stories. And here, look what all we're learning just sitting here. I mean, here I thought I read all
I'm going to
this-
be, what is it, water, what
yeah,
is
the-
the exercise
that-
on the water?
Oh, well, if we do the boot camps on the water, the aqua stretch is in
Aqua
the water.
stretching,
Yeah.
yes.
Oh,
Yeah,
aqua
that's
stretch
So
and
see,
myofascial.
now I have
Now
two
that's
new
right.
classes to do.
That's it.
Yeah. Okay, so we have a question, just got a question during the live broadcast. What's the max you should take via hormone replacement therapy? I don't know if max meaning time or amount.
Well, there is a duration in which would be healthy to start. We typically don't necessarily like to put women on it after like 65 or even in their 60s. Most women will start like mid to latter 40s up into their 50s. And also because you know that diseases, heart disease is going to increase into your 60s, 70s, 80s. But typically the symptoms that you have from menopause, the ones that we're putting women on for hormone replacement therapy, don't usually creep that much. If you look at the percentage, they don't creep that much into 60s, 70s, 80s. That's when they usually dissipate and go away and you're
Oh,
kind of done
good.
with them. So we're really doing it for women who are like, I am miserable and I need something to help.
Right.
And so whether that's with the hot flashes, libido, we can help them with the hormone replacement therapy. There is no max as far as amount. We look at what you provide. So we'll look at labs and we'll say you have this amount of estrogen or progesterone or testosterone. This is what we're trying to accomplish based on your
Pretty much in
complaints.
range.
Let's now compose the bioidentical hormone to what you want.
Right,
And that's
yeah.
that's how we'll give it.
And you feel that they're safe enough, or I mean,
They're safe when you've talked to your doctor and we've gone through what is your medical history, what are you at risk for. So for women who have hypertension that's maybe not controlled, or diabetes that's not controlled, or a history of like certain cancers, breast cancer, endometrial cancer, which is uterine cancer, those are the women where we're like, okay, well, let's take a step back and see if this is really for you. But that's why it should be a full discussion before you just like, I'm going to do it. And that's why there are a lot of people or organizations that do give hormone replacement therapy. I always recommend going to a physician to make sure that you have gotten the right counseling and making sure that you're the right person for it. But I think that women should definitely at least have that consultation because it can be so beneficial.
yeah.
Yeah.
So if you're just joining us, we're talking about hormone replacement therapy, and we've talked about many different subjects, and now we're talking about something that related is vaginal dryness. And so somebody asked about it. Is there a way to deal with it without succumbing to hormone creams? Plus,
Yeah.
hormone creams are really expensive, aren't they?
They are very expensive. And really, when you think about creams, if you use a cream, you're going to have to use it for the duration that you have that issue, right? Because as soon as you stop using the cream, then that is going to recur, whatever the issue was. So for vaginal dryness, vaginal rejuvenation is actually one of those things. We're back to vaginal
I know,
rejuvenation.
really. I want
But
to.
it really is. I mean, I have so many women who come back to me after having their therapy done. It's usually 3 to 4 sessions of whether you have the CO2 laser or the radio frequency treatment. But they come back to me and they're like, thank you.
But what is it that they do? I mean,
So it actually
it's-
stimulates the tissue. Our body is set up to accept trauma, whether that's good or bad trauma. And when it stimulates that collagen that again was affected by the decrease in estrogen,
okay,
so the collagen's like, we're gonna go away too. But that energy stimulates the collagen, which goes and recruits new collagen to come back to that area. So therefore you're kind of like enhancing the tissue in that area, also the secretions.
Right.
So people who suffer from vaginal dryness because of the decrease in estrogen are now gonna have that kind of increase in lubrication in that area. Therefore, they're not going to have vaginal dryness anymore.
And who does the rejuvenation? I mean, is it
Gynecologists
It's a
do them.
gyne-
We do
I
them in
mean,
the
you
office.
do them in your-
Oh, I do. I love doing them. And what made me so proud to be able to offer that is because people come back to me. So if they're coming back to me and they're like, this is horrible, I'd be like, oh, well, maybe this is not.
Yeah.
But they are like, thank you so much
They
for
can see
offering
such a
this
difference.
to me. And I've had women who, in my office who had it and now don't have the light bladder leakage issue or the vaginal dryness. It's great for patients who have had breast cancer and been on chemotherapy and should not take
yet.
hormones. This is a wonderful way for them to regain some of that vaginal composure and secretions. Yeah.
Well, I did have a question I was going to ask you.
Oh, yes.
But
Lube is great. No.
But it's great. I was going to
Yes.
say maybe you don't need that.
No, I think lube should be used for everybody. I always tell my patients, like, and I always ask them, like, well, how much lube are you using? And I'm like, is it this much? I'm like, this thing should be flying all over the place. Use it liberally. Why are we not using lube enough, right? So again, looking at the different types of lube, I think there are sex therapists out there. People associate sex therapists as someone who has a sex issue, but I'm like, no, actually they can teach you very healthy ways to engage in intercourse. But lube is such a great topic. I talk about it all the time. I let patients leave my office with little packets of lube to try. I'm like,
Oh
here,
my
try
God.
some of this.
Well,
and
what's
they're
your
like,
favorite? What's your, or
I
you have
like
a-
Uber Lube.
Uber Lube.
Not
Not to be confused with the no, person picking you up in the car, please.
There's
Right,
not
no,
an app for that yet.
I
Or
love-
maybe
and-
there is.
No, and it comes like in a very cute little glass bottle. So if you like happen to leave it on your nightstand, no one will be like, oh my God, there's that lube. They would never know. They would never know that glass bottle. We've gone all the way in now, folks. We've gone all the way in. But no, I think lube is great for women. And I feel that we have this idea that people who use lube, that it's a bad thing. Absolutely. I think that there should be a disassociation from lube that should be used and why it's used as if it's something bad. Lube is great. So the take-home message today is that lube is great.
Lube is great.
And everyone should use it and use it liberally.
Okay, good. Well, I was thinking maybe that the rejuvenation thing took care of that.
It does, but if
still,
you want
but-
more lube, why not?
Yeah,
Why should we not use lube? We're all leaving here with lube today.
Did you bring your samples? We want to know.
I brought samples for everybody.
Oh my gosh, it's so funny. So let's see what we've got. We've got more questions. Okay, this is something we're speaking of. We will continue to speak about, I guess, hormone replacement therapy. We're off lube a little bit. Is there any, we hate to be off lube, but anyway, is there any correlation between Alzheimer's disease in women who receive hormone replacement therapy? Is there increased or decreased risk?
Well, it's not necessarily the hormone replacement therapy. What it has to do with is estrogen. See, everything falls back to estrogen. That's why women are so powerful, because we have estrogen.
Yeah.
But estrogen, actually, they have had studies that link. Now, after menopause, you'll see obviously an increase in Alzheimer's. And when you look at male versus female, females are more at risk for having Alzheimer's. And so what they do have studies on are looking at if we give back estrogen, what amount would that be, how long would it be, and would that decrease the amount of cases of Alzheimer's that are out there? And so we do know it's very protective. Remember before we were saying estrogen is protective of the brain, it's protective of the heart and the bone. That's one of the things that we know that it's associated with, is that decrease in estrogen sometimes can increase that risk of Alzheimer's.
Wow. Okay. So that's
Goes back to fitness too.
Yes.
There's studies about
Yep,
Alzheimer's and exercise. Again,
absolutely.
our takeaway,
Yeah.
exercise is the best medicine to start with, right?
and
But
then
creating-
lube is the next.
Yeah.
And then lube. If exercise doesn't work, go to your lube. Well, I asked you earlier, like, is that joint lube, like for the knees? You're like, no, it's, okay, got it. I need to get this because mine's
But no,
off.
exercise is
it's good.
directly linked to mental capacity
Absolutely.
and ability to sustain and stay away from things like Alzheimer's. Absolutely.
Okay. Good. Well, that's another reason to work out. And let's
There's
see.
never enough reasons to not work out.
Yeah, I
right?
was going to say.
Yeah.
What about this woman says, when I gave birth to my daughter 20 plus years ago, my uterus prolapsed. Is this going to cause problems as I age?
Well, tissue is affected by estrogen and the ability for it to have recoil and flexibility, which is why we have such high levels of estrogen when we're in our childbearing years, because everything can snap back, right? So once you do have prolapse, that is because of age, but also because of estrogen. So it won't necessarily go back. It could get worse, but there are things that you can do through surgical and non-surgical ways to kind of correct that. One of the things that can help it from getting worse is exercise. So working on your core and your pelvic muscles can actually help slow down the rate at which you have pelvic organ prolapse, which is exactly what you were
Yes.
describing there.
Yes, and we actually Next Tribe did a great story about this by such a funny writer. I mean, I can't tell you, how can you make that pelvic organ prolapse
Right.
funny? She made it so funny and so readable, and it was so informative too, which I think is really a gift. So, but that's a good one to keep in mind. And might somebody in this position have the benefits from the vaginal rejuvenation?
Absolutely.
That would
It depends how much of the prolapse there is. Severe cases usually will recommend some type of surgery or surgical procedure, and those don't necessarily have to be very intent or necessarily doing a full hysterectomy, but we can restore some of those spaces in the pelvis and the vagina from prolapse, but they have varying degrees. So mild degrees of prolapse, actually we have seen some cases with vaginal rejuvenation where it restores that. Severe cases, a little bit more surgical intervention, but also pelvic physical therapists, exercise, those can help slow the rate of how quickly you're going to see that prolapse.
Pilates is a good exercise.
Yes.
for
Oh,
that
is it?
because
Yes.
It's typically slower, it's more mindful, it's more mind body connected. So that's a great go-to.
I was going to say, because when you say exercise and you think about, prolapse.
Oh,
you
you're
think
thinking squats? Yeah.
Yeah.
Maybe not squats.
Okay, so let's see. There's something here about. Oh, I think we talked about this. As we age, it seems it's hard to lose weight and easier to gain. And how can we control it? Is the answer estrogen? No, I'm kidding.
Well, it was the whole cortisol.
The
I think
okay, that's
exercise
right, yes.
and what type of exercise? You were talking about the short bursts of
The short
exercise. So that's
bursts.
more like your HIIT routine.
Your HIIT
So you
routine,
can tell
short-
about your HIIT routine.
Absolutely. So HIIT routines, HIIT is an acronym for high intensity
Yeah.
training sets. So typically, and it's hard to wrap your mind around many times if you think about going strong as you're able to within anything from a 10 to 30 second set, and then matching that time in recovery or double your recovery time, but just really escalating your intensity for short bursts of energy and then bringing it back down. I have time challenged individuals who they'll get up in the morning and they'll alternate a cardio component of, say, work 30 seconds hard, 30 seconds of recovery, and then 30 seconds of weights, and then 30 seconds recovery, and do that for a 20-minute set.
Oh, wow.
It's a great quick set. I will say also that's where some of the apps come into play. For me, if I were to try to do that at home without my timer app, I'd be like, oh, a cobweb. Okay, wait a minute. Like, oh my goodness, let me go get that cobweb, or oh gee, and so I just kind of wonder. But my timer is my accountability partner, right? You can have a personal trainer write your workouts for you, and they'll set you up with your timer. You don't have to necessarily go to them every morning, but they can write a workout for you that would keep you for several weeks, where you can do a couple different workouts like that, have that time intensity, have that exercise intensity, and that metabolism is greatly
Yeah.
influenced by those types of high
Oh,
intensity
good. Well,
training
that's
sets.
good to
Yeah,
that's
it
good to
definitely
know.
helps with spiking up the metabolism, and therefore you're going to be able to utilize your energy more, burn calories. That's what we're all trying to do.
Yes.
And gain muscle, because
Yes.
we haven't really talked about muscle being a big component of higher metabolism.
Yep.
So you want to keep that muscle up, right?
Oh, so
muscle
you'll-
is one of the
Muscle
first
mass,
things
yeah.
that we lose in having muscle mass decline as we age. So doing activities, and I tell my clients that at this age that if you had to choose between cardio, depending on what you're dealing with personally, but all systems equal, if you were to choose between cardio and strength building, go for the strength.
Yeah.
Really?
Because
Yeah.
there's so much more benefit to having increased muscle mass at this age.
Okay. Well, I'll give up my biking then.
It's balanced.
So we are winding down, and I want to thank everybody who out there. I think I've gotten to all the questions, but unless there's something you think we missed, do you think is there anything you?
I think we covered so
We
much.
covered a lot.
I think, one of the things that's important to me, especially today, since I'm here on behalf of Poise, is one, being comfortable with the conversation of light bladder leakage. I think even in the office, when women come in, it's like I have to ask them before they'll elicit that information. So not being afraid to share your story. I hope that what we've discussed
Yeah,
here
really.
today.
I talked about the taco line, so you.
Yes,
guys-
it
Right.
empowers
So
and
important.
encourages women to bring up some of their issues, talk to their doctor. Poise, wonderful products, ultra thin with the Thin Flex technology that allows women to, again, do what they need to do.
Right,
Be
yeah.
active, stand in the taco line, and then you can actually get your taco and not have to go to the bathroom. But I think that in general, I've always preached, any issue that you're having health-wise can be combated with wellness and exercise, also healthy diets. And once you really start to work that into your overall understanding of who you are and being intentional, I love that word, intentional, you'll find that a lot of the issues that you're having will actually get better. So I think it really is a lot more than we think of, just like sickness getting better.
And it's not just that woo-woo, like, I mean,
Yeah.
it really is. It's not just like abstract. It really has.
There's
makes
science
a
behind it now, and
difference.
I love, as a scientist and as a physician, I'm always like looking for numbers. And now
Right.
that we've started to move away from just like medicine and
Yeah.
the prescription and disease, and looking at wellness and mindfulness and how it affects your body, I'm all in.
Good, I love
Absolutely.
that. What about you? Anything else
I
you want
wanted
to
to
add?
say, especially in, I call it the back half of life,
Yeah.
right? When I turned 50, I vowed to live the second half different. And the first half was a ride. It was fast and it was furious. And the last half, I've really vowed just to live consciously.
I love
Right?
that.
And experience it, and not be on the ride, but be at the helm a little bit more.
Yeah.
And so all of those intentional decisions, I mean, be conscious about what I'm choosing to eat, right? Am I eating whole and real? Because the intent is to take care of myself, enjoy, right?
Yep.
And I can enjoy and savor in the moment, and live consciously through my choice of eating, through my interactions and my connections. And all of that builds the confidence. And I think once that confidence is there, then the choices come easier
Yep.
too, right? Whenever I'm confident about who I am and what I do, the choices about what I want to put into my body are so much different.
Right.
And
yeah.
learning
So-
to mute out that clutter,
So much. Yes.
and then it doesn't, you don't even hear it,
Yeah.
right? And
Because
can
you
just-
know.
Yeah.
Becomes the
What's-
white
yeah.
noise.
Yeah,
And
you're
you're
focused.
centered, and you're moving forward, and you're living your best life on the second half.
I
love
love that. I
that.
love that. So we want to thank all of you. I do want to say a couple of things that 10 of you who have commented or asked questions in the post underneath in Facebook are going to be hearing from us tomorrow, because you're going to win some great prizes that our Poise has provided, a beautiful workout bag, and then I put in some Next Tribe swag and some good stuff in there. And also, there's a coupon code. Look for that in the comments. It's going to be a coupon code for, you can get some great products from Poise. They're providing us with some discounts, which we really appreciate. And we really appreciate Poise sponsoring this broadcast and really supporting women like us and what we're trying to do in this second half of our life.
Yes.
And thank all of you for joining us, and we'll do this again soon, I hope.
Awesome. Thanks, Jeannie.
Thank you for having us.
It's been a
Wonderful.
pleasure.
Thank
Thank
you
you.
both so much for
It's been
coming.
great. Thanks.
Okay.